As still as they are here, they're exactly the opposite at home.
Meet Chris Foot's well-dressed posse, 4 therapy Chihuahuas, during a recent visit to Banner University Hospital in Phoenix.
This is Aspen. She's 2.5. This is Asia. She's 4.5. This is Seattle. She's 1.5 years. And this is Portland. And she's 1.5 years. These 2 are litter mates.
Very well-styled and well-behaved Chihuahuas.
I found that long coats are a little more social than the smooth coats, but she has really been the exception of the rule, being a smooth coat. She's very outgoing and loves people.
They're part of the hospital's pet therapy program, maybe the smallest to ever take part in it. But they play a very big role when it comes to patient recovery.
So we have our pups, and we have a good number of them, over 40, who come into the hospital and they visit with patients. It's remarkable to see what they do, not only for the patient, but for the family members as well. It reduces their anxiety. Sometimes even their sensations of pain will diminish just by having the distraction of that dog.
It took some time before dogs were accepted at Valley hospitals like Banner University Center.
When I first started, there was only like 3 or 4 dogs that were coming in to visit, and the people were asking, why are dogs in the hospital? So we had to educate them about therapy dogs.
But the benefit of therapy dogs soon becomes clear.
Well, if you've ever been in the hospital and you miss your dogs, that's what's going on.
We watched as Foot put one of her dogs to work.
I just make her into a taco.
Oh, are you a little taco? Hi there. Oh.
When a dog therapy person knocks on the door and asks to come in, and a patient sees the dog and the change on their face, it just brings them something else to think about. Your conversations are about the dogs, and they tell you about a dog they had a long time ago. Again, earlier Chris said that sometimes they'll cry, and that's okay because that's what the dogs are there for.
According to the Alliance of Therapy Dog rules, you can only work 1 dog at a time because they have to get your full attention. I love working the ICUs where people are really sick. I can put them up on the bed and they won't move, they won't touch any of the tubing or the wiring, and they lay very still and the patient can hug them.
Foot started working with therapy dogs after her own dog visited her in the hospital.
I trained them for that is because years ago I was in ICU for a very, very long time. And if it hadn't been that the nurses there were so kind, because there was no dog program in the hospital I was in, that they allowed my friends to sneak my dogs into me, I think I would have lost my mind. I'm hooked on this program. This has become my life. Would you like to give her a treat?
Oh, yeah. What's that? Oh, my goodness. Oh, yeah. She says, I like that. I like that, yes.
I'm very proud of them. They're very good girls.